Hello, I'm Dr. Helen Pensanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about a condition that remains one of the leading causes of hospitalization worldwide: pneumonia. It's more than just a bad cough. Pneumonia is a lung infection that can be mild or life-threatening, and it affects people of all ages, from infants to the elderly. To help us understand pneumonia from its causes to cutting-edge treatments, I'm joined by my colleague, Dr. Bryn Henderson, a board-certified physician and pioneer in regenerative medicine. Dr. Henderson, welcome.
Well, thank you very much.
Let's start with what exactly is pneumonia?
Pneumonia is an acute infection of the lungs. It inflames the air sacs called alveoli. These sacs can fill with fluid, making it hard for oxygen to exchange. So the oxygen has trouble moving from your lungs into your bloodstream. This is why patients often feel short of breath, have a cough, or run a fever.
Are there different types of pneumonia?
Yes, absolutely. The main types are community-acquired pneumonia, picked up outside a hospital, and often from bacteria like streptococcus pneumonia or viruses like influenza. There's also hospital-acquired pneumonia, which occurs during a hospital stay and often involves more drug-resistant germs. Ventilator-associated pneumonia develops in people on breathing machines. Aspiration pneumonia happens when food, liquid, or vomit is inhaled into the lungs. Atypical fungal or viral pneumonia are less common but important in certain populations.
All right. So the people that get pneumonia and the people that don't, what's the difference?
Oh, that's where genetics and immune factors come in. We've learned that certain genes make a person more susceptible. These genes affect how your lungs respond to infection, how the mucus is produced, and how the immune system attacks the pathogens.
So genetics does play a role, but are there early factors that affect pneumonia risk?
Absolutely. Lung development starts in the womb. If something disrupts it, like maternal infections or inflammation, the newborn may have weaker defenses against respiratory infections for life. That's why prenatal health is so important.
How do you diagnose pneumonia at your clinic?
We combine the patient's symptoms, fever, chills, cough, difficulty breathing, with a physical exam. And often a chest x-ray is essential. Often we use a spirometer, and we often order sputum or blood tests to find the exact germ.
And what is standard of care treatment today?
Well, it depends upon the cause and the severity, but mild community-acquired cases can often be treated at home or with oral antibiotics, rest, and fluids. Severe cases, however, may require hospitalization, IV antibiotics, and oxygen. Supportive care like hydration, good nutrition, and sometimes bronchodilators helps the body recover. Prevention is key. Vaccines for pneumonia, flu, and COVID save lives.
You've done a lot of work in regenerative medicine. Tell us about the promising new therapies for pneumonia.
Oh, yes. In fact, they're fun. Peptide therapies like LL37 have shown multiple targets. Antimicrobial and anti-inflammatory effects can kill bacteria, breaking down the biofilms, reducing lung inflammation, and even helping repair the damaged tissue.
Beyond medicine, what can people do at home to support recovery?
First and foremost is rest. Rest is critical, along with hydration to keep the mucus thin and a nutrient-rich diet, especially with protein and the vitamins A, C, D, and E, as well as minerals like zinc that supports healing. Avoid the smoking and secondhand smoke. And once you're well, stay up to date with your vaccinations and prevent recurrence.
What's a typical recovery like?
While many otherwise healthy people recover in 2 to 4 weeks, but fatigue and cough can linger. High-risk patients, older, and people with chronic diseases, or those who have had severe pneumonia, need closer follow-up. Sometimes we repeat chest x-rays in about 6 weeks to ensure the lungs are clear, and we use one word to track it. It's called pneumo.
So let's go over that mnemonic. P stands for?
Prompt antibiotics, empiric therapy as soon as possible.
N?
Nebulizers, bronchodilators for patients with wheezing or underlying reactive airway disease.
E?
Extra oxygen to supplement and maintain saturations of over 92%.
U?
Upright position helps lung expansion, secretion clearance, and reduces aspiration.
M?
Mobilize early encourages lung ventilation, prevents deconditioning, and reduces clot risk once stable.
O?
Ongoing support, hydration, nutrition, fever control, and even the management of the comorbidities until fully recovered.
I have to tell you a story about my sister getting pneumonia. She woke up one day and she was making, she said, oatmeal for herself. And she realized that she started at 8 o'clock in the morning, and by 11 a.m., she still hadn't finished making her oatmeal because she was so tired. She kept having to go to the couch and lay down. And she thought, oh, I'm just so tired. And by the time her husband got home from work, he took one look at her and took her to the emergency room. She ended up hospitalized for 3 days with pneumonia. So there was no hello, you're sick. She just got more and more and more fatigued.
I believe that. It's a very insidious, unpredictable illness.
All right. So thank you, Dr. Henderson, for talking about pneumonia so clearly. It's a reminder that while this is a common illness, it's not one to take lightly. So to our listeners, pneumonia prevention starts with strong immunity, which you can do by taking the right vitamins, minerals, supplements, a healthy lifestyle, and timely medical care. If you develop symptoms, don't wait. See your healthcare provider. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen PENSANTI. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.